looks like most of you can feel your abs narrow on your exhale, which is excellent. If you can feel your abs narrow on your exhale, then you practice this exhale and then you layer your movement on top of it, where you exhale for the harder part of your movement, you inhale for the easier part of your movement, and that way you're getting this contraction of your abs every time you exhale with your exertion. If you can't feel your abs narrow on your exhale, then most likely you are breathing up on your inhale, because if you breathe up on your inhale, then you're going to breathe down on your exhale and you're going to be pushing out into your belly. So in that case, you want to try to move your inhale down so that your exhale can move up, and then hopefully, I have blue hands today, hopefully you should be able to feel your abs contract on your exhale. Crafts, sorry. All right. Also, I've been getting some questions about diastasis. So I'm curious, is this something that y'all want to hear more about? Because I go back and forth in my mind whether it makes it more confusing or less confusing to talk about it. Because here's my take. So I feel like years ago, decades maybe, there was like no discussion about diastasis recti, and women would get the messaging like, oh, well, your belly has that shape after babies because that's just part of motherhood, like that's what it's like, and you're just supposed to have this belly pooch, which is not true. And then people started to understand more about diastasis recti, and it became more of a part of the discussion and more of a normal part of language that women learn postpartum. But now I feel like so many things get blamed on the diastasis, like, well, you're leaking because you have a diastasis, or you have back pain because you have diastasis. And that's not entirely true. I think that's taking the messaging a little bit too far, because diastasis is a symptom, just like leaking or pain or heaviness. All of those are symptoms of a system where the internal pressure isn't managed well. And so I tend to focus on the management of the internal pressure because it solves the diastasis, it solves the leaking, it solves the heaviness, the prolapse, it solves the pain. And the pressure management is really the key. But sometimes people need more information on the diastasis because it is part of the equation. Like, we want to know that it exists. We want to know how to narrow it. We want to know when it's functional. It's worth considering. It's worth understanding that it exists. But anyway, tell me if you want to know more about it, or if you're satisfied with the idea of focusing on internal pressure, because I'm never sure exactly which direction to take this conversation.